Hey everybody, welcome. This is Dr. Izabella Wentz, and I'm really excited to have Dr. Stephen Eisenberg here with me today. Dr. Stephen Eisenberg is a triple board certified physician. So he's board certified in internal medicine, medical oncology, and hematology, and he sees patients in San Diego. Today we're actually going to be talking about thyroid cancer. So this is one of Dr. Eisenberg's specialties, and I'm really excited to have him here because he's very integrative minded. So a little bit more about Dr. Eisenberg. He's had numerous hospital best bedside manner nominations, and he was the first recipient of the Dr. Emanuel Fleigelman Humanitarian Award for the doctor exhibiting highly compassionate care during residency. So this is a doctor that really cares about his patients, and that's kind of another reason why I'm really excited to have him here. He's a graduate of Singularity University in Exponential Medicine 2012. He is the executive producer and host of the Dr. Stephen Show, the premier health and wellness TV show online. He's also known as the singing oncologist. So Dr. Stephen Eisenberg co-writes songs with amazing individuals living with cancer through Lyrical Life, which is a passion project of his that was featured on the Today Show. So welcome, Dr. Eisenberg. It's so great to have you here with me.
Thank you, Isabella. It's a pleasure to be here, and looking forward to our discussion today because thyroid cancer is a big deal, and we have to really we have to get the word out that there's so many things people can do nowadays.
Mm-hmm. Absolutely. And I work with mostly Hashimoto's community, and a lot of the questions I get are actually around thyroid cancer. So we do know that thyroid antibodies, especially thyroglobulin antibodies, which are one of the type of antibodies seen in Hashimoto's, I would say probably about 80% of people with Hashimoto's will have thyroglobulin antibodies. Yeah. Those are sometimes, they have been associated with thyroid cancer as well. And some types of thyroid cancers actually will feature thyroglobulin antibodies, and these antibodies can be used for prediction of how aggressive the cancer can potentially be. I personally had thyroglobulin antibodies and thyroid peroxidase antibodies when I was diagnosed. So my thyroid peroxidase antibodies were in the 2000 range and thyroglobulin was in the 800 range. And, I worked really hard to get those thyroglobulin antibodies down to 0 because I was concerned. I did not want to increase my risk for thyroid cancer, as I'm sure nobody else does. So I'm very excited to have you here.
I think it's a wonderful idea to check those antibodies for oncologists. So kudos to you, and I love your community, and power to the patient. Power to the patient. So that's so important.
I love it. And Dr. Eisenberg, can you tell me a little bit more how you came to be this integrative oncologist? Because you're a classically trained oncologist, so you work at a large center in San Diego, and, tell me a little bit how you kind of came on this journey.
Yes, so it's very simple. I'm an integrative guy, an integrative kid who grew up in this family with my dad is a family practitioner and did medical acupuncture on his patients in the 70s.
Wow.
And I'd go in on Saturday. He had Saturday hours, and I'd go in and I'd help around the office. And I just started talking to patients and learning about how he would blend, Eastern and Western, and back then it wasn't called functional,
right.
Holistic or whatever you wanted to call it back then. And so I grew up as an integrative guy. I worked in a health food store during medical school, and my colleagues, my co-students would be pulling all-nighters, as I would too, but they'd be like, dude, try this no-dose. And I'd be like, no, ginseng and green tea.
Oh.
That'll be much better to keep you alert and, pulling an all-nighter. So and then I thought, I thought the science around oncology was cool, but even more than that, more than just the breakthroughs scientifically, was what field could I make a difference in? What patients could I touch? Using laughter and music and the human spirit, right? That's like a big deal for me, and that's was like one of the reasons I became a doctor was where could I use some of my personality to impact people, human beings. So that's really the journey, and I decided that those people facing life and death issues could use someone to maybe leave them a little bit happier, just a teeny bit. I'm not saying I'm special at all, but like leave them a little bit happier than when you met them. So that's how I became an oncologist, and I always love bringing in the mind, body, and nutrition and integrative aspects because you're treating a whole human being. You're not treating a disease, you know?
Right.
And
Right.
so thyroid, it makes so much sense because of what your community knows and how you guys go beyond just your day-to-day conventional medical wisdom to really bring in mind and body and supplements and nutrition and fit. It's all connected. We are connected human beings on many levels that doctors, quite frankly, haven't even figured out, right? And there's more about medicine that we don't know than we know.
Mm-hmm.
So, I always stay open-minded, and I encourage my colleagues to be open-minded and to work as a powerful partnership with naturopaths and pharmacists and chiropractic. It's a partnership. It's not one type is be all end all, in my humble opinion.
Mm-hmm. And I love that. And I think sometimes when we go through training, we just start taking ourselves so seriously, and then we kind of get too deep into the weeds. And I've had so many people reach out to me and say like, "Oh, my doctor just looks at my labs, and they don't like listen to anything that I say, and I'm feeling horrible, but they're telling me that my labs are good." And so I'm just really grateful for doctors out there that actually listen to the patient and take what the patient has to say in consideration. And then, keep an open mind to all of the different types of possibilities and all the different healing modalities that can really help a person rather than just maybe what you learned in school. Because like you said, we're always evolving. Medicine is always evolving. I know I finished pharmacy school 10 years ago, and I know there are so many different medications that have come out since that time. There's so many different theories that have changed. And this is just, as we grow as a society, we're going to see more and more of this. So really appreciate the work that you're doing in the world, and really great that you have that stance. So let's kind of talk a little bit technical here.
Mm-hmm.
How common is thyroid cancer? Do you
So
behind that?
yeah, 62,450 cases a year, and 45,000 of those are women.
Wow.
And so, and around 1,900, over 1,900 deaths a year, which is,
Wow.
it's pretty significant. And the most common forms of thyroid cancer are very treatable, and outcomes are great, especially when you're combining modalities. Again, in my humblest of opinions, a partnership is the best. And interestingly, there was an article that you brought to my attention recently that California, of all places, has a higher incidence of cancer. And we were talking about why that may be, and we were thinking, well, there are some definitely areas of higher pollution, environmental toxins. There may be certain populations that are not diagnosed at a later point, but I think there's definitely a link with environment, and there's nature and nurture.
Right.
So we're sequencing the whole genome now, and we have such advances the way that we are treating cancers, and certain thyroid cancers, we're giving new biologic medications. But I think there's definitely that nurture and nature part, the environment and our minds and pollution and diet. So I think, why California? Who knows? But I think there's definitely some extra pollution in pockets that could be contributing.
It's kind of interesting. When I moved to Los Angeles, I just finished pharmacy school. This was a year after I was done with school in 2007. And I loved Los Angeles. It was amazing. I just got married and it was such a really great time. But it was also around the time that I started having some health problems. I started having a chronic cough and I started having allergies. And I had talked to some of different colleagues, and they said that back in the day, I think it was maybe in the 80s, people who would come to the Midwest from California, they'd have chest x-rays, and they would show that they had so much more pollution in their lungs that their doctors would be shocked. And so definitely think pollution plays a role. And personally, I was diagnosed with Hashimoto's and all these weird things. My body really started to take a turn for the worse when I was in California. So I don't know what it is. If it was, I did live by the airport, and we know that airport has a lot of pollution. And of course we have all the potential traffic, right? So there's a lot of different possibilities. I definitely think, of course, if you have better access to healthcare, which we know with Medi-Cal, which is the basically public aid in California, that's available to more people than perhaps in other states. And maybe we have some of the top, universities and some of the top medical centers and top doctors like yourself. So maybe we have a greater chance of detecting cancers. But I also think that it's not just the detection and it's not just, better access to care. I definitely think, looking at this recent article, there's definitely something else that's happening in the air, I think.
Yeah, it only would make sense because, I mean, why? There's so many people, there's so many cars, and less public transportation than other parts of the world. So it's very interesting, and I think we need to keep an eye on that and keep following it for sure. The story's not over.
Mm-hmm. Yeah, definitely. And so, would you say, in your opinion, what are kind of the environmental triggers besides pollution for cancer? What is there anything that you're aware of or that you might hypothesize could be responsible for higher thyroid cancer rates?
Well, there's also, especially in thyroid cancer, there's exposure to radiation.
Mm-hmm.
I'm wondering some of the toxins that may be reaching California from, the Pacific Ocean. Obviously there's been recent major disasters in Japan. We're not going to get into that, but you have to think about some of the radiation exposure, and that's really been linked to thyroid cancer. For example, any woman that's been radiated or for lymphoma, for example, Hodgkin's disease, even any radiation involving the neck, you're much higher risk of thyroid cancer. And those patients are followed closely for the development of potential thyroid cancer. But just environmentally, think about, the nuclear power plants in San Onofre, for example, and then, unfortunately, some of these horrendous accidents that have been occurring elsewhere and then sort of drifting towards California. I think, unfortunately, we're not going to see a decrease in these incidents because of the most recent happenings over the last couple of years. So I think radiation and then the ongoing toxins and just in the air, I think those are the two biggies, in my opinion.
Mm-hmm. Yeah, I definitely think so. I don't know if I ever told you this, but I'm actually a Chernobyl child. So I lived I lived in close to the Ukrainian border. I grew up in Poland, and the rates of, thyroid cancer, Hashimoto's, thyroid antibodies, the closer you were to Chernobyl, the higher the rates were. There was one study that I found that it was crazy that children of a certain age that were exposed to Chernobyl had about 80% of them had like thyroglobulin antibodies. And in the general population, we're looking at like 5 to 20%. And so definitely, I think that plays a role. And, just obviously when we have natural disasters, or I guess that wasn't a natural disaster, when we have disasters of that sort, of course, we know to protect ourselves, but there are also everyday things like going to the dentist and getting dental x-rays. I know some people have been refused, the dentists don't use thyroid shields. And,
No.
it's a really simple thing you could do, just put a little shield over your thyroid gland, and so that you don't get exposed to the dental x-rays, because
That's brilliant.
connection with increased rates of thyroid cancer from even dental x-rays, So I feel like there's everyday things that we can do to help ourselves.
I don't think dentists even ask, do you want to shield your thyroid? Unless they're like super integrative. That's an amazing point. And I think we should, I think your community, maybe you should have those available for people. And it's just huge.
They're available on Amazon.com. So that's where I usually lead people to, just to have their own, in case, one person's dentist said that, one of my clients was like, well, my dentist said that it actually makes things worse. And I'm like, I haven't seen any research, and refused to give them a dental shield.
Yeah.
Of course.
That's
One sec. Yeah, so I recommend dental shields for everybody that's going to the dentist. A lot of the dentists that are progressive and that have been following the latest American Thyroid Association guidelines will know that you need to have a thyroid shield. Some of them might be outdated. So, in that case, don't feel bad about asking for a second opinion, and don't let them bully you into getting an x-ray without having a thyroid shield, because, you want to protect yourself, protect your thyroid. And so, let's talk about, basically I've heard different doctors say that if you were to get cancer, that they would choose thyroid cancer. What do you think about that? Or,
well, I totally understand that statement, and it's not incorrect in that our treatments have really progressed into a very good cure rate, particularly for the follicular types of cancer. Papillary and follicular thyroid cancer are very treatable, very curable. I'm going to go out on the limb and say that. Obviously, there are a few other subtypes which are more aggressive. Anaplastic is very aggressive thyroid cancer, and medullary are tougher forms, but they're much rarer. So the most common forms that we see are very treatable and curable. And so I recommend a multidisciplinary approach.
mm-hmm.
You got to have your medical oncologist, you have to have your integrative oncologist, integrative endocrinologist, and you got to have Team Izabella Wentz on your side to really, it's the trifecta in my opinion, because you have to have that advocate that is going to look for those other things that are less talked about and less available when you're just doing purely conventional medicine. So things that, many patients do need surgery, unfortunately, if it's a very serious thyroid cancer. But there's things you can do from the integrative standpoint to heal better.
Mm-hmm.
And to not get an infection, for example, in your wound. So, I don't like to give, I don't like to have patients have to do surgery or do any kind of chemo or anything like that unless it's absolutely necessary and it's a curative situation. So there's a lot of patients out there that are integrative minded and don't want to do completely overly aggressive things. But when you're curable, that's when you have to start balancing things and thinking, okay, integrative means the best of science meets the best of healing from all over the world. So if you have to have a little surgery, but then follow it with integrative treatments and you're healing and you're doing great things and you're cancer-free for the rest of your life, those are the times when I think we look at science and nature and we combine them.
Mm-hmm. Yeah, and I'm in agreement with you with a lot of the lifestyle interventions. They're wonderful and they can really, really help prevent conditions. And then in slow conditions like Hashimoto's, you can definitely slow down the progression and sometimes reverse the condition. But I'll still recommend medications because medications are going to be the fastest way to start feeling better. And when you have a cancer that could potentially cause, in some cases potentially lead to the loss of life, I think you really have to weigh your options. And I like to tell people not to subscribe to dogmas, when they're health, because there are some people out there that'll say like, oh, you should do everything naturally, or you don't do any kind of natural medicine because it'll kill you. It's evil. And I just think like, no, we have brains and we have choices. And what we need to do is pick the best from different avenues. So there's a lot of great things in conventional medicine. There are medications and procedures that can be done to really help save somebody's life. And there's also the things in complementary medicine. And I like to think of complementary because a lot of times it complements, what's being done medically. And those interventions can be really, really helpful for accelerating healing or preventing issues. But yeah, in some cases when, especially if the cancer has progressed, it's like, I don't know, like if you're not going to be able to slow it down that much or reverse it with natural means in every case. And so absolutely, it's a matter of like for some people, it's a matter of sticking to a dogma or saving your life. Right.
Right. I love that you said that. I call it the best of the best, and always follow your intuition and your heart. And I just love that you said that. And really prevention, lifestyle prevention, stress reduction, nutrition. And, there's always the weird case where someone's lived, a perfect kind of existence in terms of diet and they're healthy. And I mean, one of my offices is right near a meditation temple. And unfortunately, I see patients, who are just meditating every day and eating a pure vegetable diet, broccoli and meditation. And unfortunately, I'm treating some cancer. And so I say, there's some patients where, look, there's nothing that you did to cause this. Mm-hmm. Patients blame themselves. Oh, if only I hadn't blah, blah, blah. It's my fault. I was thinking negatively. I mean, I always tell patients, look, it's okay to have a bad day. It didn't cause your cancer. And so be gentle with yourself. Don't beat yourself up. It's okay to feel that this is not, you're having a bad day, and that's okay. Yeah. And that you didn't cause your cancer. In many, many cases, it's just a random mutation in one of the thyroid cells. But I do think prevention is key, and to always, look, I mean, like we said, everything's connected.
Mm-hmm. Yeah, absolutely. Now, what are some of your integrative approaches to cancer treatment?
Okay, got it. Well, it's really a three-pronged approach, I guess you'd call it, using mind-body medicine, and then diet and fitness. So exercise, first of all, exercise has been really linked with better outcomes in thyroid cancer. So I always try, when patients are when anyone has a diagnosis of cancer, they go through this depression in many cases and probably stop moving. They stop moving their bodies. So I just say, keep moving. A friend of mine who's a fabulous integrative oncologist, Dr. Keith Block in Chicago, has treadmills in his office, and patients getting cancer treatment are walking on treadmills during the treatments.
I love it. Boost their
and
endorphins,
physically.
right?
Yes, that's my endorsement. And he's just fabulous. Hello, Keith, if you're watching. And has like a physical therapy unit right in there. So you're on the treadmill lifting your little 1-pound weights as you're getting your treatment. So fitness, keep moving. And of course, diet. Of course, I'm going to say the old adage to eat lots and lots of vegetables, right?
Yeah.
Fruits and vegetables. I happen to love cruciferous vegetables.
Mm-hmm.
And I think they're key for cancer prevention. You know, those micronutrients that you really can't even hardly test for, but they're found. Those anti-cancer properties are in broccoli. I mean, it's just that simple. So, you know, whole foods with broccoli, especially, I think is great. And I'm going to bring up the green tea again because I think green tea once or twice a day, even decaffeinated,
Mm-hmm.
uh, has a wonderful, the polyphenols in green tea have a great anti-cancer effect. I mean, these are things that your whole community already knows, but even for thyroid cancer, omega-3 fatty acids, walnuts, flaxseed is huge.
Good.
Yeah, Alaskan salmon if you're eating fish.
Yeah, I do recommend, I definitely recommend omega-3s and lots of cruciferous vegetables. I think there's a big myth out in the thyroid world that if you eat crucifers, you're going to shut down your thyroid function because of the goitrogens in them. But
Right.
actually, that's actually a myth because back in the day, they did some studies and they found that basically these types of vegetables, when in the raw state, could potentially block iodine intake in the thyroid gland. Well, most causes of hypothyroidism are actually not due to iodine deficiency. And the effect of these crucifers is like not that significant. You'd have to eat like a whole barrel of
Right.
broccoli in most cases. So I think that's one really important myth that it's, you know, crucifers are great for detoxifying your body and they're great for cancer prevention. So that's something that I think the thyroid community really needs to be aware of is to not be afraid of the broccoli.
Yeah. Don't eat the barrel. It's like when my patients say, when I find low potassium, and they're like, well, I'll just eat a banana. Like, well, your potassium's low enough that you'd have to eat a 6-foot banana. So, I mean, there's limits. There's definitely limits. But, and then I think that some of the energetic techniques are very complementary. Things like healing touch
Mm-hmm.
and Reiki are
Mm-hmm.
very, very useful for patients going through thyroid cancer treatment. And of course, you want to avoid environmental toxins, harmful radiation. The dental thing was brilliant. So great that you brought that up. And any other environmental toxins that you can avoid would be smart. And then the third prong, if you will, of my approach is supplements.
Mm-hmm.
And I'll call them smart supplements because, you know, things, I do get patients who come in with bags and bags full and they dump them on the desk and say, what about this, Dr. Steven? You know, like just dumping a whole bag. And I go through each one because I'm that health food guy, the health store guy from medical school. And so I made it my business because unfortunately the internet is fabulous and the right communities like yours, kudos, it's the best. But then you have also the other side that can sort of prey on people who are desperate with end-stage cancer. And so you have to be careful because you'll go broke buying all these supplements. So I really try to get down to the 3 most important supplements for you. And to make sure you're taking enough, like a little sprinkling of this, a little sprinkling of that, take the right amount of things that have been really shown to make a difference. Like, I love mushrooms.
Mm-hmm.
I think that I brought some with me today. Where is it? Where are they? Oh, anyway, you know, the Paul Stamets mushrooms. I just love medicinal mushrooms for people with cancer because it's just very, very good for the immune system, and we are really making strides in immunotherapy now.
Mm-hmm.
Yeah, huge strides in immunotherapy where your own immune system is recognizing the cancer as foreign. You know, these are cells that don't belong here. And so maitake, shiitake, these mushrooms, I think, are very safe and very good for cancer patients, cancer survivors, especially thyroid cancer. So I'm a big proponent of mushrooms. I mean, these are things you can eat, but
Yes.
the way that they're prepared in these comprehensive supplements are very good. And then what else do I think? I think that coenzyme Q10 is helpful and vitamin D are helpful to reduce the risk of recurrence.
Mm-hmm.
And 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 a good source of B complex. You know, B12 has been shown to be very good for thyroid cancer patients. So, you know, it's not an exhaustive list. It's really not. I mean, there's lycopene, which I also like. Lycopene and the mushrooms and vitamin D and CoQ10 and omega-3s, I think, are really, really solid for those patients. And, you know, and then you have to balance um, the effects of surgery and coming back from surgery. And obviously some patients go through what's known as radioactive iodine, which sounds horrendous, doesn't it? Radioactive iodine. Those are for more advanced cases where you may have lymph nodes involved with cancer around the thyroid, or even if it's spread to a distant node, or, you know, lymph nodes under the arm, or even a distant organ. Then you get into things like trying to ablate any other areas of thyroid that might be harboring metastatic disease. Again, that's where you really need a good endocrinologist, an integrative-minded endocrinologist that will be open to things to help you get through such a treatment. Because that's scary when you hear, I'm going to put something radioactive in my body.
Mm-hmm. Yeah, absolutely. And, you know, I love how you differentiate between the fish oils and snake oils with your patients. Because, like you said, there's just, unfortunately, the society that we live in, like, we've got people that really care and really want to help people. But then there's kind of the dark side of people who are, you know, really out there trying to take advantage of people. And fortunately, you know, I've been in this situation where I've been taken care of or been taken advantage of, and, you know, it just, there's people out there like that. So for people who are interested in medicinal mushrooms, is there a brand that you recommend or that you like to use that's a high quality brand?
Yes. It's called Paul Stamets, Staments. And I like the comprehensive daily immune support. I might have it here. You give me 1 second. I have it. I brought it with me because I knew we were going to talk about it.
You did. That's awesome. Thank you. So it's
Comprehensive
organic mushrooms.
Host Defense. It's called Host Defense by Paul Stamets.
Okay, Stamets. Okay, great.
And I take it myself.
Okay, and what's
I only recommend things to my patients that I put in my own body.
That's how I am too. Appreciate it.
Yeah, comprehensive immune support, and you can get it at any health food store. Very high quality. I don't have any stock in it, so I put it in my own body. So I like that. And another one that I like, Enzyme Defense.
Enzyme Defense.
By Enzymedica.
Enzymedica. Okay, that's a great
Very
brand.
safe. It's just a enzyme formulation that supports the immune system. So enzyme. It used to be called virus stop. Now they changed it to enzyme defense. So those are two.
Okay, great. Yeah, I'm a big
I
fan
brought
of
them.
enzymes as well.
I brought them because I really thought that if I showed your amazing community, all of you out there watching right now, that I'm putting these into my body daily, if ever I'm feeling, even if I'm well, I mean, I'll take it just to sort of maintain, just to maintain. But if you're feeling like you're coming down with something or whatever, you can up it a little.
Now, what would be like a maintenance dose range for people who are perhaps preventing cancer, or with the medicinal mushrooms?
Yeah.
Would you go with what's on the bottle, or do you have a special recommendation that's different?
Well, I don't think you can take too much. I think they're always a little conservative, but I think 2 capsules a day for the medicinal mushroom formula, the comprehensive immune support, and then 1 capsule a day for the enzyme defense would be great for maintenance.
Mm-hmm.
And if you're for patients going through treatment, I would double that.
Okay.
I would just double it. It's not on the bottle, but this is food. This is food and enzymes that you really cannot overdose on. So sometimes you have to up it because they're conservative.
Mm-hmm. Yeah, absolutely. And I'm a big fan of vitamin D and B12. And that's actually, I don't know if you knew this, but that's one of the first tests I recommend for people with thyroid conditions, is to make sure they have their vitamin D and B12 tested. Because when you get that in an optimal range, your immune system's going to work much better. With some of the medicinal mushrooms, I know there's some controversy about when you have an autoimmune condition about stimulating your immune system too much. And so there's been some literature out there with, like green tea or medicinal mushrooms, perhaps driving up one part of the immune system. And so I think this can happen in a small percentage of people. For most people, it should be okay. But, I just always encourage everybody who's listening and doing stuff online to, 1, do their own research, 2, talk to their own healthcare professionals, and 3, listen to their bodies, because, we know more about our bodies than anybody else. So just while we're discussing all these wonderful things, just, for people listening at home, I always like to kind of throw that reminder out there to, be cautious and listen to your own body and talk to your own healthcare professional.
Yeah, completely agree. If you have to find that sweet spot within you. Of course, with the mushrooms, you want to get to that point where you're just regulating things really nicely. I mean, you don't want to, if you're getting into trouble with autoimmunity and you're stimulating too much, of course. But I think it's more sort of that immune regulation. Things are just in a balance. So if you can always cut back.
Mm-hmm.
You can always cut back. If 2 a day is too much, 1 a day, 1 every other day. Find that sweet spot for you. And I totally agree with you. It's not, you have to find what works best for you.
Yeah, absolutely. And I think some people are afraid of medicinal mushrooms. And somebody just asked me one of my readers, because I read all of my emails, and one of them asked if I could write an article about it and debunking it, because I know a lot of people can really benefit from these mushrooms, but some people are afraid of, the immune boosting potential. So I will be putting out more information about that soon sometime. And if I can get some, quotes from you, that would be great.
I would love to help you with the article. I would love it, because I really think that more than just a pure stimulation, it's more of a balancing. I think it makes what you have a little healthier. It's not like you're taking a non-functioning immune system and suddenly turning it into 100 times. So I think we can definitely debunk some of it, but it's not for everyone. But I think the benefits outweigh the risks in most individuals.
Mm-hmm. Yeah, I would agree. So what are some of the other, speaking of debunking myths, so what are some of the other thyroid care myths that you can kind of debunk for us?
Well, that if you eat too much iodine, you'll get thyroid cancer, or if I eat salt, I'll get thyroid cancer, or if I get any X-rays at all, I'll get. I mean, some people do need some X-rays. If you're coughing up horrendous looking, stuff for lack of a better word, if you're, bleeding when you cough or anything like that, you're going to need a chest X-ray. So there are benefits to radiology in certain. Yeah, of course. So again, I think it goes back to what you mentioned about dogma, that certain things we can do when necessary, when our symptoms are such that the benefits would outweigh the risks of causing a thyroid cancer. But the everyday things, like the dentist and avoiding toxins and all of that, very smart.
Mm-hmm.
But just, in terms of, putting a little salt on your food, of course, you don't want too much because of the hypertension and all of that. But just, if you're having some Himalayan sea salt, I don't think you're going to stimulate thyroid cancer.
Mm-hmm.
But, so those are some of the little myths. People tend to be very afraid of the word iodine.
Mm-hmm.
And so, but a little bit's necessary for us, for our normal thyroid function. So that's important. And I think those are some of them that I would mention.
Yeah, thank you for sharing those. I think iodine is a very controversial topic, and of course, there's kind of a sweet spot with iodine and thyroid where if you don't get enough, you're going to have thyroid issues, and if you get too much, you're going to have thyroid issues. So it's kind of something that's really important to keep track of. And generally, for most people, I would say somewhere between 150 to 300 micrograms per day is the sweet spot, especially if they have Hashimoto's, just because that range can get a little bit more narrow. So you don't want to avoid it for forever. There's, certain times when you may need to avoid it for short term before certain procedures or whatnot, or, if you're having a flare up because of being exposed to very high amounts. But generally, you do want to make sure you have some on board and definitely not too much. And so other thing I wanted to ask you about was any, thyroid cancer breakthroughs.
Yes. So sequencing again, back to like the human genome,
Mm-hmm.
it's been amazing in terms of breakthroughs for cancer. So this gets to the more, I pray nobody watching this ever has to deal with this aspect, but some of the more aggressive forms of thyroid cancer, something called medullary thyroid cancer and anaplastic thyroid cancer. I have several patients, unfortunately, that these cancers have spread to the bone.
Record.
Okay.
Go.
So unfortunately, for the more aggressive thyroid cancers, anaplastic and medullary, with patients that have metastatic disease, these are very debilitating. But there have been breakthroughs now where before we could just give these horrendous chemotherapies that didn't hardly help at all. Now we can give pills that are biologic agents that are targeting the ways that the cancer cells communicate with each other,
Mm-hmm.
and signal growth, and much less side effects than traditional chemotherapy. So things like, they're called TKIs, tyrosine kinase inhibitors,
Yeah.
and they're biologics. And so these are very, very much a breakthrough for advanced thyroid cancer, the bad players. And I, again, wish no one has to deal with this, but this is a topic that we can talk about another time for those patients that are really advanced. But for those patients that do have to deal with that, there's breakthroughs, pills that you take just on a daily basis with less side effects and have good response rates that can shrink that cancer and help with your symptoms.
Mm-hmm. Tyrosine kinase inhibitors. Yeah.
Yes.
They weren't around when I was in pharmacy school, and I remember learning so much about tyrosine kinase that I just remember being like, why doesn't anybody have tyrosine kinase inhibitors? So now they're here. It's just amazing the different types of signaling pathways that we can now target with all these innovative treatments.
Yeah, and it's the future of oncology. One day, we'll just test your genome We'll find the mutation that your cancer happens to express, and then we'll give you that blocker that will signal, that fixes that signal and turns it off, or has the chromosomes back to where they belong, and then your cancer will just go away. That's the future of oncology, just smart drugs, no more chemo rooms. That's what I pray I see in my lifetime.
I love it. I love that. So one other thing, because I know we've got to wrap up here, is looking at thyroid cancer 101. So if you had somebody that was, just a few things you wanted people to know or get them to understand, what would they be?
Three simple points. Don't ignore it. If you feel a nodule, get an ultrasound.
Mm-hmm.
Not the end of the world. An ultrasound is safe. It's just what a doctor uses to look at a baby in a mom's belly, and it's very safe. The easiest way to diagnose thyroid cancer is just a tiny, simple, tiny little thin needle, called a FNA. So don't ignore a nodule. It's okay. You can get a scan. You can get an ultrasound. Sometimes it's better to know than to just ignore. So a biopsy is not going to certainly make it spread everywhere. It's a tiny little thin needle. I say sometimes it's better to know than just ignore and, put your head in the sand and, oh, it's fine, it's just nothing. So that's the one thing. Don't ignore it. 2, multidisciplinary approach. Find yourself the integrative oncologist, the integrative endocrinologist, and email Izabella Wentz and get on the community and talk to the other members of the community that have gone through any thyroid cancer. And the last point is three-pronged approach: diet, nutrition, and mind-body.
Mm-hmm.
Even if you've got cancer, never lose that ability to be gentle with yourself. Don't beat yourself up. Give yourself a hug and say, I'm going to beat this. And life is going to go on as normal. This is a bump in the road. It's extremely treatable. And with the support that you have here with this community, you can go really, really far and have an amazing journey and be cured in the end.
I love that. Dr. Stephen, thank you so much for coming on and just sharing your wisdom with us. I really, really appreciate you being here. Anywhere that people can find you or anything else that you'd like to let them know about?
Yeah, sure. Everyone can find me at drsteven.com, just like you'd write it, drsteven.com. And if you want to reach out to me directly, it's easy, steven@drsteven.com. Come back and watch the show where we have Izabella Wentz on the show in February 18th.
Mm-hmm.
Going to be on the show, and we're going to talk about her amazing journey through all of this and how she created this community and the difference she's making in the world. So join me for that, and reach out, ask any questions you want to me, to steven@drsteven.com. And it's been a pleasure to be here. Thank you for having me.
Absolutely. It's been such a pleasure having you, and I hope everybody at home has really enjoyed this conversation that we've just had, and I hope it'll help you on your journey.